Trombocitopenia. Trombocitopenia it is any disorder in which there is an abnormally low number of platelets, which are part of the blood that help clot.
Blood cells are produced in the bone marrow. The three main components of blood are red blood cells, which carry oxygen, white blood cells, or leukocytes, which fight infection, and platelets, also called thrombocytes, which assist in the formation of blood clots. When a blood vessel is damaged, platelets adhere to the surface of the damaged vessel and release chemicals. These chemicals attract more platelets as well as red blood cells in order to form a clot or thrombus. As the clot grows, the blood vessel narrows, thereby decreasing blood loss. This process is called coagulation. Normal platelet counts are in the range of 150,000 to 350,000 platelets per microliter. Trombocitopenia is a disorder in which there are not enough platelets. When the platelet count is decreased, the body is unable to form blood clots and therefore is unable to control bleeding. Bruising and bleeding can occur from relatively little trauma. When the platelet count gets below 10,000 platelets per microliter, bleeding can develop without trauma. Chemotherapy-induced thrombocytopenia is a disorder that develops as an adverse effect of chemotherapy. Cancer drugs not only kill cancer cells, they can also damage the platelet-forming cells in the bone marrow. The severity of this disorder depends on the type of chemotherapy and the duration of treatment. Fortunately, chemotherapy-induced thrombocytopenia can be managed with platelet transfusions, additional medications such as blood cell growth factors, or with blood stem cell transplants.
Cause: inadequate platelet production in the bone marrow, increased breakdown of platelets in the blood, increased breakdown of platelets in the spleen or liver.
Therapy of patients with a low platelet count is very interesting because the guidelines for the use of ruxolitinib in United States talk about using ruxolitinib in patients with the platelets of 100,000 or more. But remember, there are no contraindications for use of ruxolitinib for patients with myelofibrosis. So how do we use this medication, which is very effective in spleen and symptom improvement in patients with low platelets? Common sense approach. We start with the lower dose. While there are guidelines for patients with good platelets, for lower platelets there are studies underway that show that starting 5 milligrams twice a day in a safe way, avoiding any myelosuppression or dropping of the blood cell count is very good. And then in a month time, you go to 10 milligrams twice a day, and in next month maybe even to 15 milligrams twice a day. So stepwise increase based on safety and a need for patients to go to higher dose is the best way when we talk about starting patients with the low platelets on ruxolitinib.
Symptoms: bleeding in the mouth and gums, bruising, nose bleeding, skin rash, smear, red spot, caged splashing. Treatments: treatments depend on the cause of the condition. In some cases, it may require platelet transfusion to start or prevent bleeding. The site having bleeding hemorrhage is the may complicate and may occur in the brain or in the digestive tract.
adults, the treatment is relatively simple and involves suppressing their making of antibodies which are attacking their own platelets. And it's usually done simply by giving them some form of corticosteroids. The fetus is a different story because the disorder is more severe and more apt to lead to bleeding in the fetus, the worst kind of which is bleeding into your brain. So we have to treat the fetus through the mother. It's not easy to directly give the fetus platelets, which we can do. But more commonly what we're trying to do is give the fetus immunosuppressive therapy to blunt their making of antibodies or antibodies that have been made by the mother under these circumstances that cross to the fetus and attack the platelets. So we treat it by a combination of steroids given to the mother to tone down her making these antibodies that don't hurt her, that hurt her fetus. Number two, making it so that the antibodies don't destroy the platelets as fast. And occasionally we actually have to even transfuse platelets into the fetus. In adults,